Hello, my name is Richard Acosta. I am a recovery specialist for Kern Behavioral Health and Recovery Services. I currently work on the RISE team, and we are going to go through a case study, understanding the ASAM assessment more comprehensively. The ASAM stands for American Society of Addiction Medicine, and this PowerPoint was created by Thomas Fries, Albert Hassan, with contributions made by Jan Tice. Okay, the mission of the ASAM criteria, as you see, is to help clients or patients receive the most appropriate and highest quality treatment services, to encourage the development of a comprehensive continuum of care, to promote the effective, efficient use of care resources, and help enhance access and protect funding for care. The biggest shift with the ASAM criteria is we're no longer program driven in its individualized treatment. The ASAM criteria offers a system for improving the modality match through the use of multidimensional assessment and treatment planning that permits more objective evaluation of patient outcomes. Okay, here as we see, we have 6 dimensions. The first dimension is acute intoxication and or withdrawal potential. So right here, this is where we are assessing for imminent danger, maybe some withdrawals, some symptoms the client or patient has been experiencing. Could be nausea, maybe vomiting, whatever the case may be. Just these types of conditions. Also, we have Dimension 2, the biomedical conditions and complications. So right here we are looking for some medical treatment services. Some clients may have more challenges in this dimension. Could be medically impaired. Maybe they have severe back pain or just anything that would impede their potential treatment process due to biomedical conditions and complications. Dimension 3 is the EBC, ASAM terminology, emotional, behavioral, or cognitive conditions and complications. Right here we're looking for impaired cognitive functioning. We're going to find out the level of problem solving skills that the client currently possesses. This dimension right here replaces is a mental health, the old mental health domain of the ASI. So look at it in terms of the mental health domain if you're using a crosswalk. In the readiness to change, Dimension 4, this is where we want to see how motivated the client is to change. Right here you'll be able to get a good grasp of what stage of change they're in. Dimension 5, relapse, continued use, or continued problems potential. So here we're focusing on substance misuse, their ability to use or not use without any treatment. Also right here we're looking for any type of patterns or tendencies that the client has displayed during their substance misuse. In Dimension 6, recovery and living environment. This dimension we're looking at how stable their housing situation is. Any kind of family support they are receiving. Also right here in this dimension, we would want to address if they need any kinds of legal services or help in that area. Also, you would want to address furthering their education if that is something that they want to look into, or vocational services. And just remember that this ASAM assessment the focus is to stay away from program-driven treatment and focus on individualized treatment. Think of whole person integrated care. It's a client-centered modality. Okay, and here we have the different ASAM levels of care. Currently in our system of care, we have level 1 outpatient treatment. And as you see the definition there, what it consists of. Level 2, intensive outpatient. We also provide that level currently. And 3.1, residential treatment. And then with our NTPs, level 1 opioid treatment programs, we also provide that right now as well. In the future, we will be able to provide services for these other types of levels. Okay, so now we're going to get into our case study. As you see, there's a nice picture of John Doe. Okay, so just a quick summary of Mr. Doe. He is a 27-year-old Caucasian man with a history of opioid misuse who was referred to substance use treatment for heroin use and depression. He entered IOP 2 weeks ago, intensive outpatient. Prior to that, he went to the ER looking for pills. He was hostile and manipulative, later admitting that he just wanted to avoid withdrawals. He then reluctantly agreed to enter detox and intensive outpatient. Strong cravings after medically assisted withdrawal. Willing to try treatment even though he doesn't believe in it, and he's given a referral for medication-assisted treatment, MAT, and was started on buprenorphine. Okay, some more information about Mr. John Doe. He has used opioids for the past 3 years, originally for pain. As you see, he switched to heroin 8 months ago. He's been drinking alcohol since the age of 16, so he's 27, that's roughly 11 years socially. Occasional marijuana use and 2 to 3 tobacco cigarettes per day. He currently is a transient and unemployed. He's unable to function at work due to his increasing substance use. He lost his job and apartment 1 year ago and is crashing on friends' couches. Little social support. His family was unaware of his drug use. And also we see he's reported feelings of sadness, lowered self-worth, and loss of interest. He just wants to get high with pills or smack. All right, so as we see John Doe again, and we want to engage the person in their own care. And you see on the left there, program-driven is what we no longer do, and now we're individualized. So you have the what. Here's where you want to ask the client what they want, and try to get as specific as you can when getting these details. What it is exactly that they would like to see happen. The why. Here you would want to inquire about why they feel it's important to change, or even if it's mandated, why is it important for them to enter a treatment program? How is the client going to achieve their goals, objectives, or it could just be how they're going to get started with the process. Where? So right here you want to ask the client where they would like to receive treatment. Hopefully there are options, multiple options in this. When you ask this question, sometimes it may be limited. However, remember the importance of whole person centered care is that we want to give the client as many options and choices as possible. So maybe they would want to go to receive treatment at option B as opposed to option A. And when is the client going to begin receiving treatment, and the frequency of services, and then how that all applies to the treatment plan. Okay, assessing immediate needs and imminent danger. Immediate can be assessed in person or over the phone, should address each of the 6 dimensions and include these components. The strong probability that certain behaviors will occur. So some examples given: continued alcohol or drug use. That such behaviors will present a significant risk of serious adverse consequences to individual and or others, possibly while they're driving or the neglect of a child. And the likelihood these events will occur in the very near future, within hours or days, not weeks or months. Also, when you're talking about imminent danger, here we are looking for the most pressing issues that the client is reporting. And here we have the demographic information. Our system of care's version of this is very similar. And also you see here that there is another brief summary of what's going on with Mr. Doe. This says he lives with his daughter and her family, husband and 2 grandchildren. You have all the basic information there: who he was referred by, race, ethnicity, age, gender, preferred language, phone number, address, name, of course, and the date. So the quick summary here is Mr. Doe has been abusing opioid pain medications for the past 3 years and began using heroin 8 months ago. After his doctor refused to refill his medication, he suffers chronic pain from a bicycle accident that occurred 3 years ago that has impaired his ability to function. He lost his job and apartment due to opioid use and has been staying with friends. Okay, so as we take a closer look at Dimension 1 for this client, Mr. Doe, and Dimension 1 again is the acute intoxication and or withdrawal potential. We want to explore his past and current substance use and withdrawal. So as we see on the left-hand column, these are the substances that Mr. Doe has struggled with since the age of 16: alcohol, heroin, opioid pain medication, and marijuana use. And we have used in the past 6 months all of the before mentioned substances. You have prior use, lifetime, alcohol, opioid pain medication, and marijuana is checked. You have the route of administration, the frequency, duration of use, and date of last use, which this information is very important to get an accurate idea of where Mr. John Doe stands regarding his alcohol and other drug use. So right here, looking at this slide, Mr. Doe's primary substance would be heroin. The frequency was daily for an 8-month period, and his date of last use was 3 weeks ago. So we have some additional substance use info. Client reports that his primary substance of choice is opioids. He reports he has most recently used heroin but would take pain medications if he were able to obtain them. Dimension 1, acute intoxication withdrawal potential. So just some key questions here within the Dimension 1 ASAM assessment. Do you get physically ill when you stop using alcohol and or other drugs? Yes. Describe when I have trouble getting pills or have to reduce my use. I begin to sweat, sneeze, get chills, and feel nauseated. Next question, are you currently having any withdrawal symptoms? No. It says that not currently, but reported feeling anxious, sweating, some nausea, and loose bowels before starting buprenorphine. And question C, do you have a history of serious withdrawal, seizures, or life-threatening symptoms? The answer there is no. Denied seizures, though reports times of severe withdrawal with nausea and vomiting. And at the bottom, client answered yes to having times when he used more drugs than he intended to, and recently changing his opioid use from just pills to pills and heroin. Reports that his father was an alcoholic and he was never around very much. Okay, so here we have the severity risk rating for Dimension 1. The rationale would be that Mr. Doe was not exhibiting signs of withdrawal at the time of the assessment. So the question, are there any problems to address in Dimension 1? I think it's important that, we pay close attention to Mr. Doe, but he currently, pertaining to this Dimension 1, acute intoxication and withdrawal, he would be rated at a 0. Non-issue or very low risk issue. He has no current risk in any chronic issues likely to be mostly or entirely resolved. All right, moving along to Dimension 2, the BMC, the EBC, biomedical conditions and complications, exploring health history and current physical condition. So let's take a look here. Mr. Doe has a primary care physician. He was given a list of medical conditions. Mr. Doe responded that he has muscle and joint problems, sleep problems, some chronic pain, stomach and or intestinal problems. Until 8 months ago, he had been prescribed oxycodone, Percocet, and Vicodin. After attempts to get pills from other physicians, his doctor refused pain med refills. Suboxone is only current treatment identified for the above. Do any physical conditions concern you or significantly interfere with your life? Yes, he reports pain causes his sleep problems and interferes with social and recreational activities. Pain related to bike accident 3 years ago, which resulted in hospitalization and opioid treatment. And for Dimension 2, the rationale is client's chronic pain impairs ability to work and social or recreational activities. He has had difficulty managing even with opioid treatment. He has not sought other pain management strategies or treatment for other health issues, including mental health. So as we look at the potential answers for the question, are there any problems to address in Dimension 2? Our options are yes, he is addicted to opioids. B, yes, he has chronic pain which has not fully responded to opioid treatment. C, yes, he has a number of undertreated health problems. D, both B and C. And option E, no, there are no Dimension 2 problems. So as you see, the correct risk rating for this dimension is a 2, moderate. Difficulty in functioning, some chronic issues, some difficulty tolerating problems, neglects care for acute, non-life-threatening biomed problems. And the correct answer for number 2 is D, both B and C. He has chronic pain and has not fully responded to opioid treatment, and he does have some undertreated health problems. Okay, Dimension 3, emotional, behavioral, or cognitive conditions and complications. Mr. Doe marked the following areas as problematic for him. With the mood, there's some depression, hopelessness, and irritability, or feeling angry. For anxiety, there are some flashbacks. Other, he mentioned sleep problems and a traumatic event when he was hit by the car as a bicyclist. Do you have any thoughts of self-harm or harm to others? He answered no there. Have you ever been diagnosed with a mental illness? If yes, did you receive treatment? No, he denies being diagnosed with a mental illness or even being treated for mental health issues, though he thinks someone at the hospital recommended he get some help after his accident. Do you see or hear things that other people say they do not see or hear? He answered no. And then right here under E, you want to ask yourself, based on the client's responses, is further assessment needed? And for Mr. Doe's case, it would be yes, due to the depression and hopelessness, anger, irritability, some flashbacks that he's been experiencing. So the summary here, Mr. Doe reported feelings of depression, loss of interest in things he used to enjoy, and being startled awake with images of the car about to hit him. Client could benefit from a mental health assessment. The Dimension 3 rationale says client's mood and emotional symptoms warrant mental health assessment and, if appropriate, services integrated with addictions treatment. Issues do not seem to severely limit functioning or impede recovery efforts. This dimension may elevate based upon assessment results. So here, the question, are there any problems to address in Dimension 3? Out of our choices and options, the most appropriate answer would be B. Yes, he has multiple mental health symptoms which need to be assessed and appropriate treatment provided. And then for the risk rating for Mr. Doe in Dimension 3, it would be a 1, mild, non-issue or low risk issue. All right, moving right along to Dimension 4, readiness to change. This is where we want to explore John Doe's readiness and interest in changing, and also this is where you're going to be able to get an idea of what stage of change Mr. Doe may be in, pre-contemplation, contemplation, whatever the case may be. So for A, to the questions, is your alcohol, other drug use affecting any of the following? Given the list of choices, Mr. Doe responded, work, relationships, physical health, finances, recreation, self-esteem, and handling everyday tasks. So as you see, Mr. Doe is affected in a majority of areas in his life. B, have you ever received help for AOD problems? He answered no. C, what would support your recovery? He said friends, family, financial support, help with cravings, and help with pain management. And as you see, his barriers are finances, friends who drink, and his pain. So the summary here for Dimension 4, Mr. Doe appears willing to enter treatment if his craving and pain management needs are met, and he worries that quitting may be too hard. He denies problems with marijuana and alcohol, but is willing to look at his opioid use as long as he has help with pain. So as you can see, Mr. Doe is recognizing his issues with opioid use, however, still needs some addressing regarding the marijuana and alcohol use. The severity rating for Dimension 4, rationale. On the plus side, client has already willingly engaged in medicated assisted treatment, articulates an understanding of the negative consequences of his opioid use, and appears willing to explore further strategies to manage recovery. On the side of concern, his motivation is highly tied to pain management, and his concern about and commitment to change his alcohol or other drug use seems low. Client may need extra support in addressing substance use. So for this dimension, it would be most appropriate to place Mr. Doe with a 1, mild rating, willing to enter treatment, but is ambivalent about need for change or believes it will be very easy to do so. And as we ask ourselves a question, are there any problems to address in Dimension 4? Yes, he is in total denial. B, he is only motivated if he gets medications. C, he may need assistance to maintain his motivation. And D, no, he is solidly committed to his recovery. So the correct answer would be C. Yes, he may need assistance to maintain his motivation. Okay, Dimension 5, the relapse, continued use, or continued problems potential. Here we want to explore an individual's relapse experiences and or the history of continued use. A, in the past 30 days, have you had cravings, withdrawal symptoms, or trying to recover from your use? I don't crave alcohol or pot, but I do crave pills and heroin intensely. B, do you feel you will relapse or continue to use if you don't get treatment or additional support? Mr. Doe answered, I would definitely continue to use without the buprenorphine. So that further stresses the importance of the medication-assisted treatment in this case. Question C, are you aware of your triggers to use alcohol and or other drugs? Mr. Doe states he has triggers, strong cravings, difficulty with handling his feelings. There's relationship problems, unemployment, chronic pain, and his environment. What do you do if you're triggered? Mr. Doe stated he would use if he felt triggered. I can't find the urge. The need to use won't go away until I do so. Until I do. Dimension 5 continued. Have you tried to control your use, stop or cut down? Mr. Doe states client denied any attempts to quit using until this treatment effort. F, what is the longest period of time you have gone without using? What helped or didn't help? And here you want to summarize what he had stated earlier in the assessment. He said these past three weeks were the longest time without using since the accident. He added that he had decreased his alcohol use after college because he was no longer in that party environment. In the summary at the bottom, Mr. Doe admitted to spending time searching for drugs and or trying to recover from using. He reported feeling unsure of what to do with his time now that he is not using. As we move into the severity rating for Dimension 5, says the client has some knowledge of relapse triggers and does not minimize his high risk. However, he appears to have minimal coping skills to prevent relapse other than his MAT. As mentioned before, Mr. Doe stated that he would use if it weren't for the buprenorphine. Client would benefit from CBT and relapse prevention training. So in this dimension, it would be most accurate to rate Mr. Doe with a 2, moderate, difficulty, impaired understanding of substance use relapse issues, but is able to self-manage with support. And the question, are there any problems to address in Dimension 5? A, yes, he is chemically dependent. B, yes, he needs recovery. MAT is just a substitute. C, he requires addictions treatment, which includes moderate intensity relapse prevention. Or D, which is no, if he continues on buprenorphine, he will be fine. And the correct answer for this dimension is C. He requires addictions treatment, which includes moderate intensity relapse prevention. As we see Dimension 6, the recovery and living environment, we want to evaluate the individual's living situation, environmental resources and challenges, and also include support from family and friends or lack thereof. A, do you have any relationships supportive of recovery? Mr. Doe stated unsure. The description there, client describes poor relationship with father, okay with mother and siblings. They might be supportive if they knew what was going on. He has some supportive friends, but most don't know he's using heroin. So this could be a situation where you might want to talk to Mr. Doe about including certain family members to aid him in his recovery efforts. B, what is your current living situation? It says client is currently crashing with different friends. He lost his apartment after he lost his job because of missing too much work. C, do you live where others drink and or use drugs? Description, most friends drink, smoke pot, but do not use opiates. And D, are you in a relationship which poses a threat? And he states no, but says someplace he stays are kind of shady. All right, Dimension 6, continued recovery and living environment. Are you in a relationship which could negatively affect your recovery? Client is worried friends won't be supportive, especially when they find out he has been using heroin. G, are you currently employed or enrolled in school? Mr. Doe is not. He lost his job. He previously worked in sales and has a business degree from a 4-year university. And H, are you currently involved in social services or the legal system? And Mr. Doe states no. The quick description: client denies any legal problems, but states that I did sue the person who hit me. So this might be an area to address once Mr. Doe is further along in his recovery process, more stable from an emotional standpoint. Okay, Dimension 6, the risk rating. The rationale: Mr. Doe appears to have limited social, financial, and environmental support. His need for an environment which supports his addiction and physical health recovery must be considered. He would most likely benefit from the clinical structure of treatment. So here in this particular dimension, it would make the most sense to rate Mr. Doe at a 2, a moderate. Environment is not supportive of recovery, but with clinical structure, individual can cope. And then our questions for Dimension 6. Yes, he has multiple risk factors with housing, relationship support, financial stability, and meaningful environmental structure, including employment. B, yes, he is homeless and must be in residential treatment. Or C, no, if he just tells his parents what's going on, he will get the help he needs. So for this particular dimension, the most appropriate answer would be A. Yes, he has multiple risk factors with housing, relationship support, financial stability, and meaningful environmental structure, including employment. And here we have a recap of the 6 dimensions of the multi-dimensional ASAM assessment. So for Dimension 1, we rated him a 0. Acute intoxication and or withdrawal potential. Remember, he's been in treatment for 3 weeks, and currently there is no immediate danger. For the second dimension, biomedical conditions, placed him at a 2, moderate, due to the pain that he still suffers from due to the bicycle accident. Dimension 3, emotional, behavioral, or cognitive. John Doe reported some irritability, some anger, depression, hopelessness, some sadness due to his overall situation. So in that dimension, we put him at a 1, mild. Further mental health assessment would be most appropriate for him. Dimension 4, readiness to change. We rated him at a 1, mild. If you remember, he willingly entered IOP treatment. However, he stated that without the continued support from buprenorphine that he would relapse. And also Mr. Doe only seems motivated at the moment to address the opioid addiction and not so much the alcohol and marijuana use. In Dimension 5, gave him a 2, relapse continued use potential. After learning about John Doe's case study and gathering all the information, placed him at a moderate in this dimension because he does not have a supportive environment. He stated that he would, use heroin more than likely if he did not have the buprenorphine MAT treatment. And for Dimension 6, his recovery and living environment, John Doe was also rated at a 2 there due to the lack of support from his family. He mentioned that sometimes he is in kind of shady situations, and he is not involved with the environment conducive to recovery on a day in and day out basis. And then on the right side of the slide, we have our ASAM levels of care again, and not all of these are currently within our system of care, but will be in the future. So we have the next slide, decision flow, matching patient's focus, assess needs, treatment placement, intake, and assessment. What does the patient want and why now? So this is very important to engage the client and start off building that rapport and helping the client feel fully vested in their treatment episode. What are the immediate needs or imminent risk in each of the dimensions? So again, you want to assess what types of symptoms the client is experiencing, and regarding imminent risk or the seriousness, the danger of the situation. In particular, Dimension 1, the acute intoxication withdrawal potential. If it's a particular client that needs immediate medical attention, we would want to make sure that is addressed. And number 3, what are the diagnostic and statistical manual of mental disorders, DSM diagnosis? Well, here it is critical to remember that within your scope of practice, clinicians would appropriately diagnose clients using this DSM-5 manual. Next slide talks about service planning. Identify which assessment dimensions are most important, the treatment priorities. So when you talk about medical necessity and how that ties into Title 22, this is extremely important because we want to connect the assessment, the ASAM assessment, with the appropriate dimension and why that client meets medical necessity in that whatever respective dimension you chose while performing the assessment. Choose a specific focus and target for each priority dimension. So if the client is most impaired in Dimension 3, which has to do with the cognitive functioning and maybe problem-solving skills. Remember, that's that mental health dimension. This is where we would want to possibly refer the client to get a mental health assessment or maybe some type of psychological evaluation. Number 3, determine what services are needed for each dimension. So as we go through the ASAM criteria, you can see that most of the dimensions do intertwine and there is some overlap. So that's why it's important to always think about services as opposed to what level of care you place the client, whether it be a 1.0 outpatient or 2.1 intensive outpatient. I mean, that is important, but again, think about the services that the client needs and what is most going to help him or her progress in their treatment process. So next slide, level of care placement. What dose or intensity of these services are needed for each dimension? Maybe in addition to outpatient treatment, the client would benefit from receiving medication at a narcotic treatment program. Number 2, where can these services be provided? Least intensive but safe level of care. Geographic location, I think here is important. You want to look at the client's means of transportation, and if that is a challenge, it would be very crucial to place the client somewhere that they can attend on a regular basis. And the third one, determine discharge criteria. What outcome measure will describe progress and influence placement decisions? So when you think about the continuum of care in the new direction we're going with ASAM, this is very important because the discharge criteria is something that we can think about extending the recovery process, the treatment episode, or depending on the client's progress and the pace that they are improving, maybe the discharge would then be sped up. It just depends on the client. Remember, the care is now, it's on an individual basis. We're no longer program driven, and we have a lot of flexibility within each level of care to individualize treatment. You hear the term cookie cutter, and that is definitely something that we want to stay away from. An example of that would be, the same size, same shoe size fits all, and we know that's not true. Some clients might need a combination of groups, medicated assisted treatment, and self-help meetings or sober support groups. Some clients may just be able to attend one group maybe 2 groups a week because they're already working or they're just involved in other forms of treatment that is helping them make progress. So that's why it's very critical to effectively communicate and know exactly where your client is at any moment of time. Okay, as we look at this LOC placement, level of care, number 1, what dose or intensity of these services are needed for each dimension. Number 2, where can these services be provided? Least intensive but safe level of care. And the third question, determine discharge criteria. What outcome measure will describe progress and influence placement decisions? And then we have a list of references and resources. You see the ASAM criteria book there, the Change Companies, California Institute for Behavioral Health Solutions, obviously UCLA Integrated Substance Abuse Programs, and the Pacific Southwest Addiction Technology Transfer Center. Thank you for joining us. If you have any questions pertaining to the ASAM webinar, please call me at 661-868-6148. Thank you and have a great day.